Greetings and welcome to our research study on the effects of electromagnetic fields on bones, on the humans in microgravity. Really modeling the effects and with myself and our co-authors Terry Trevino, AC, Shin, and many more for the Ascend 2022 conference and on behalf of Magneto Space. With these affiliated organizations as well. So jumping right in, we're starting out with the key biological challenges being the effects of long-term microgravity on biology and cells and ionizing particles and radiation in microgravity and transit. And there's also this concept of the near null magnetic field that beyond Earth's geomagnetic field here depicted. And so we can see that there's this lack of electromagnetism outside of Earth orbit and low Earth orbit in particular. And so this imposes biological challenges for cellular adaptation in such a lack of electricity and magnetism. And so here's an overview to the study, really attempting to modeling the effects. And so most astronauts do not currently use electromagnetic fields in space. And so there's been over 300 studies at least demonstrating the effects of pulse electromagnetic fields. And so this company, IWS here, and one of our partners, they published a lot of research, and they found that the PMF increased bone recovery by 40% and fracture healing by 46%. And so it's theorized that long-term 60-day duration of these pulse fields can reduce the bone loss or maintain 20 to 50% of bone density on humans and other mammals and vertebrates in microgravity. And so we're proposing this on-orbit experiment with 2 to 4 humans or astronauts in low Earth orbit. And so we're proposing to bring this lightweight, low-power BIOSTIM wearable, where that's depicted here on the top right, that would be positioned on the tibia or shin bones for pulse around 6 to 8 hours a day, as a passive experiment during night while humans are sleeping. And so it's also important to realize that a lot of bone restoration and healing occurs while sleeping. And so we can see here some diagrams. This one being an overview on the effect of pulse fields on the osteoclasts, osteoblasts, and the relevant transcription factors and osteocytes, which are both upregulated and downregulated. And so here is a really depicting the calcium ion channels and other electromagnetically volted gated ion channels that are affected on the cellular membrane from these pulsed fields. And yes, and so biomedical analysis would quantify the effects of the bone loss and the amount of calcium and phosphate in the blood in microgravity compared to the control crew members. And so hopefully we can quantitatively assess if we can maintain 20 to 50% bone density, and successful results would demonstrate these pulsed fields could provide essential life support for humans and organisms beyond Earth. So here's a slide on common spaceflight issues and really what's going on with the with bones in microgravity. And in particular here, we can see that the osteoblasts, they're decreased, and so there's this reduction of bone formation, and this mechanical unloading also increases the bone resorption and osteoclasts with these relevant upregulated transcription factors and enzymes. And so this leads to this imbalance of bone formation and resorption, resulting in the loss of calcium and phosphate through the bones. And more about some of the, there's been a lot of published research out there, and so astronauts currently lose around 1 to 1.5% of their bone mineral density per month, which is the equivalent of 2 decades of aging. And so this other study found that the astronauts had permanent bone loss in their shin bones around negative 3.9%, with this chart here depicting other body parts such as the spine, the femur, and the neck bones that resulted in the largest change in bone mass density. And here we can see the modeled bone BMD change for a Mars mission, and we can see here that these are you're approaching the upper limits of the human skeletal system, and so really what's going on a cellular level here is that these ion pathways and signaling, there's this imbalance, and so we know that with the stages of bone remodeling, the resorption occurs over 2 to 6 weeks, and then there's the mineralization, which can last much longer, around 2 to 6 months. And so these the pre-osteoclasts from the osteoclasts from the stem cells, and similarly with the pre-osteoblasts and osteoblasts, and finally with the mineralization of the osteocytes, which so there's this deposition of bone and minerals. And so we know that 99 to 80% of the human supply of calcium and phosphate respectively are found in the formation of bones, and that transport of the inorganic phosphate inside the matrix vessels prior to the influx of the calcium ions across the membrane helps form these crystals and collagen fibrils. And here we can see some of the calcium ion membrane-bound channels and pathways with the phosphate as well. So here are some of the studies done on the effects of pulsed fields on bone density. And coming back here, we can see that osteoblasts are specifically sensitive to the PEMF, and there are these sensory organelles called the cilia, which are largely responsible. And also these osteoblasts, they align parallel to the magnetic fields after however long amount of exposure, which is really interesting if research might suggest that sleeping and being oriented parallel to magnetic field lines might help increase the amount of bone mineralization and restoration. And here's a chart on the bone matrix and the effects of the positive and negative gradients on the bones. And so here's more about the on-orbit experiment we're proposing with pulsing around 30 to 50 hertz with these lightweight sub 3 kilogram devices. And really, and so really the significance and future research, we're looking to evaluate the effects of pulse magnetic fields on more susceptible bones in microgravity, such as the tibias, the neck, the femur, and the spine, and then also other spaceflight associated symptoms such as SANS, fluid shift, and more. So that's it. Thanks so much for listening, and yes, ad astra.